Hi everyone. I did my 5P project on mental health in Eastern Kentucky. So, more specifically, to promote better mental health outcomes by improving accessibility and affordability of mental health services in Eastern Kentucky. I chose this passion for two reasons. I have some professional and personal experiences that I kind of like to talk about. On a professional level, I am employed by the Cabinet for Health and Family Services. I'm a child welfare worker. I'm employed in Campbell County. If you're unfamiliar with that territory, it borders Cincinnati. It's kind of like a highly populated area in the city, but then there's also very heavily rural parts as you get closer to more rural counties like Pendleton County. Um, and I noticed in Campbell County, a lot of my clients have transportation issues where they can't physically get to mental health services. The mental health services that we have, like North Key, those are all in the city area. Now, I have a lot of clients that are in the rural areas of Campbell County, and it's a good 30 minutes maybe to get to some of these services. And if they don't have transportation, that's a huge barrier that they need to overcome. Also, there's client insurance issues. I know with North Key, a lot of times they only take Medicaid, and they don't take private insurances. Now, a lot of my clients do have private insurance, and that's kind of a barrier for them as well if they need mental health services. Um, Clients also don't reside near mental health facilities. So as I was mentioning, a lot of the mental health facilities that we have are in the city area, and a lot of the clients that we need to refer to mental health services live out in rural areas where they don't have access to those services. And then also the limited access to treatment due to employment conflict. So a lot of my clients with the cabinet do work, and a lot of mental health services are not always open for the times that they need to be open because clients are working, and it's really hard sometimes for them to just take off of work to go and get mental health treatment. And then I do have some personal experiences. So I personally battle with multiple diagnoses. Um, I have personal conflicts like time and employment conflict. Obviously, with a cabinet, I work the regular 8 to 4:30 day, and I work a lot of overtime. So a lot of times it's really hard for me to make time to get in to see my psychiatrist. Um, Also, the stigma. It took me probably about 6 months of my coworkers and my fiance trying to um, motivate me to go see somebody to talk about my mental health, because there's just that stigma that people are going to look at you differently, people are going to judge you, mental health is not okay to have. Um, so that's kind of where we're at with this. um, I thought that this was a cool statistic. This is the map of Kentucky. And if you look, I have it listed out on here, the region 9 through 12. Those are more along the lines of the Eastern Kentucky areas. So I have all those counties listed there. More specifically, Mountain is the mental health service um, that part of the Eastern Kentucky utilizes. As you can see, number 7, North Key, that's what I was talking about, the mental health service that we utilize. Um, I also wanted to take note that for the 5 counties in Region 11, there's only one specialist, a clinical specialist for those 5 counties. There needs to be at least 2 people in each county, I think, to really promote and advocate for better mental health services. So you can already see that there's a lack of services. And then so we have profession identify. So according to Social Work Speaks, the NASW identifies mental health as a common health concern that affects millions of individuals in just the United States alone. So over 26% of adults in the United States experience mental health concerns. Those are just the reported statistics. There are so many individuals in just the United States alone who don't report their mental health. So I would imagine that the statistics are much, much higher, but it's looking like only 26% because of um, not mental health not being reported. And then again, we see those barriers of cultural disparities, access to care, the stigma, and then some reimbursement challenges. So again, the NASW states that mental health concerns um, in both children and adults often result from childhood trauma or abuse and neglect, which I put that in there because I obviously see with my daily job. Mental health is the fourth highest concern in rural areas in the United States, and that's because there's a lack of the services. And then untreated mental health in rural areas may lead to higher rates of suicide, homelessness, substance use, and incarceration. So if we can figure out a way to lower those rates, then we would see incarceration rates go down, substance use go down, homelessness go down, and then the rates of suicide as well go down. And then social workers and mental health organizations are currently in the process of developing and implementing recovery models and movements, but there's no indication how long that's going to take. It's definitely a very hefty process and definitely time consuming and takes a lot of money too. So we have profession describe. So the code of ethics guides social workers in serving the community and advocates for successful outcomes for clients. So I specifically chose service as the core value and ethical foundation because I really think that service is going to increase accessibility, affordability, and effectiveness of mental health services. Um, Social workers use knowledge and skills to address mental health concerns and find effective treatment for clients. They also collaborate often with mental health providers on behalf of their clients to see, what's working, what's not, how can we improve. Social workers also assist clients in reducing accessibility barriers to making services more available for clients. I know for the cabinet, a lot of times we try and figure out some transportation issues where we provide clients with bus passes so they're able to get around to their providers that we have them set up with. And then social workers advocate for more funding to mental health organizations to make services more affordable. And then I have elaborate. So I just have some questions on there. How can social workers help eliminate the barriers to clients receiving mental health services? Are there any mobile mental health services that travel to client homes to reduce barriers of receiving mental health services? So that would be like mobile car services that would come to your actual home. So if somebody has a transportation issue, they'll be able to receive those services without having to actually go somewhere to get those services. And then if there are mobile mental health services, are they effective in reducing accessibility and affordability barriers? And then what have other states done to resolve these barriers and make mental health services more accessible and affordable in rural areas? So those are just kind of some questions that I have. And then I also had some statistics here that you could look at as well. For apply, I have individuals in Eastern Kentucky are at a disadvantage due to a lack of mental health services. We continue to see a lack of mental health services in Eastern Kentucky, despite so many policies that are being implemented or that are being heard at the House and Senate levels, and we're still seeing these lack of services. I mean, when I was doing my research, I found so many policies on mental health, but you don't hear about them in the media. It's not, something that people talk about a lot. And then further mental health trainings and implementation of mental health services in Eastern Kentucky would be beneficial. So this goes for clients, this goes for mental health providers, doctors, nurses, social workers. We could all benefit from more education regarding mental health. This also works in ending the stigma. And then just in general, more implementation of more services. That way we have a variety of effective services that our clients can choose from that are close to them. And then So the policy that I chose is Helping Families in Mental Health Crisis Act of 2015. That's the House Bill 2646. So it was initially introduced in June of 2015. It was amended by the Committee on Energy and Commerce on July 6, 2016, and it was also passed within that same day. So the goal, and I couldn't have said it better, so that's why I have it in quotes here. The goal is to make available needed psychiatric, psychological, and supportive services for individuals with mental illnesses and families in mental health crisis and for other purposes. So essentially, it's saying that everybody who is in a mental health crisis, whether you have, anxiety, depression, you have bipolar, something more, you are allowed to have these services. And then it's more specifically to provide affordable and accessible mental health services to individuals and their families. The policy also works to address other issues as a result of poor or untreated mental health. So as we go back to what I previously discussed, higher incarceration rates, homelessness, substance use, we're hoping that with better mental health policies and treatment facilities, that we can promote better mental health outcomes so we can reduce incarceration rates, homelessness, and substance use. So I chose Senator Robin Webb as my politician. She's a Democrat. I have a little bit of background on here. She was born and raised in Ashland, Kentucky, but she currently lives in Grayson, Kentucky with her family. If you're unfamiliar with those two areas, they're both in Eastern Kentucky. She graduated initially with a Bachelor of Science degree from Morehead State University, and then she went on to law school at Northern Kentucky University and graduated with her law degree. She has owned her own private law firm since 1986. And then previous employment before she was a senator, she was a coal miner. She was an attorney for the Natural Resources Cabinet, and she was a general counsel member for the AEI Resources, Inc. Then I have on here some of her government history. So she is a Democrat. She has served at the government level since 1999. She was previously at the Kentucky House of Representatives, representing Carter County District 96 from 1999 to 2009. And she's currently serving as a senator for the Commonwealth of Kentucky Senate, District 18, that's also Carter County, from 2009 to present. And then I have some committees that she's a part of. She's very big in agriculture and energy. So she's part of the Agriculture Committee, the Appropriations and Revenue Committee, Budget Review Subcommittee of Transportation, Joint Committee on Natural Resources and Energy. And she's actually a part of 15 other committees that I did not name on here. And then I thought it would be worth noted that she was also had previous membership to the Kentucky Bar Committee on Domestic Violence, Kentucky Jail Standards Committee, and then Domestic Violence and Child Protection Committee. And I think that those are pretty relevant to what we're talking about as well. So for one of my organizations, I did the National Alliance on Mental Health, that's NAMI. And they specifically provide advocacy, education, support, public awareness to all individuals and families affected by mental illnesses, and hopefully they can better their lives. They also focus on empowerment and ending the stigma behind mental illnesses and receiving mental health services. And then I read this on their website. I thought that I'd add it because it's really cool, but NAMI's currently advocating to push Congress to help individuals with mental illnesses during COVID-19 pandemic. I know that I'm suffering pretty heavily right now with the mental health and working from home. It's been a huge struggle. I can imagine that there's millions of other people that are in the same boat. So I think that they're really doing a good job at pushing Congress to focus a lot on mental health at this time. And then I also did Project Semicolon. So Project Semicolon is a suicide prevention organization that works toward reducing rates of suicide and improving mental health. The main goal is to raise awareness and educate individuals on the impact of mental health, um, on actual survivors of suicide or individuals who have suicide ideation. And it also raises awareness to educate individuals on the impact of suicide has on loved ones. So personally, I have lost a family member to suicide. It was a huge impact on me. I was very close with this family member. So um, it's definitely something that I hold near and dear to my heart. So I definitely partake in this organization. And then the founder is Amy Bluell. She kind of ironic, but she actually passed away from suicide a couple years after she formed this organization. Um, and then I also have for impact, individuals in Eastern Kentucky can have better mental health outcomes if the following occurs. So implementation of more services, specifically mental health in Eastern Kentucky communities. So I'm talking like one in every single community. I know that's a high goal. I know that's a lot of money. That's a lot of people to train, but I really think it's something that needs to happen so that, we can treat mental health and have better mental health outcomes, especially as a state. Um, and then there also needs to be an increase in funding for mental health services to be implemented. So that is where it gets a little tricky, because that is going to be financially a lot of money to invest. And then implementation of mobile mental health services to further address transportation barriers. I really think that that's going to be a great idea for the clients who don't have transportation, they're disabled, they can't make it out. A mobile service that can work around work schedules, I really think that that would be highly beneficial. And then social workers and mental health organizations continue to advocate for effective mental health services and policies. So we need to stay on top of politicians. We need to call our local politicians. We need to call local organizations like NAMI and Project Semicolon, and really put in make our voice be heard, essentially. And then, as we talked about a little bit earlier, this process is not easy. It's going to take time. It's going to take effort. We're going to need a lot of financial support to make this happen. But I really think if this happens, it's going to make Kentucky better as a whole. And then I have references for you guys here. All right, thank you.